Laboratory investigation in diabetes. Laboratory investigations play a crucial role in the diagnosis and management of diabetes. These investigations help healthcare professionals understand the patient's condition, assess their glycemic control, and monitor the effectiveness of treatment. Here are some common laboratory tests used in the investigation of diabetes. Remember frog U. F equals fasting plasma glucose, FPG. R equals random plasma glucose. O equals oral glucose tolerance test, OGTT. G equals glycated hemoglobin, HbA1c. U equals urine tests. Fasting plasma glucose, FPG. This test measures the blood glucose level after an overnight fast of at least 8 hours. It is used to diagnose diabetes and assess glucose control. A fasting plasma glucose level of 126 mg per deciliter, 7.0 mmol/L, or higher on 2 separate occasions is indicative of diabetes. Oral glucose tolerance test, OGTT. This test is performed to evaluate the body's response to glucose. Initially, the patient's fasting blood glucose is measured, followed by the consumption of a glucose-rich drink. Blood samples are taken at regular intervals, typically 2 hours, to measure glucose levels. An oral glucose tolerance test can help diagnose diabetes and identify impaired glucose tolerance. Glycated hemoglobin, HbA1c. This test measures the average blood glucose level over the past 2 to 3 months. It provides an indication of long-term glycemic control. The HbA1c level is expressed as a percentage. In individuals without diabetes, a normal HbA1c level is typically below 5.7%. However, an HbA1c level of 6.5% or higher on 2 separate occasions is indicative of diabetes. Random plasma glucose. This test involves measuring blood glucose levels at any time of the day, regardless of the time of the last meal. If the random plasma glucose level is 200 mg per deciliter, 11.1 mmol/L, or higher, along with the presence of classic symptoms of diabetes, such as frequent urination, excessive thirst, unexplained weight loss, it may indicate diabetes. Urine tests. Urinalysis can help detect the presence of glucose and ketones in the urine. Glucose is a simple sugar that is the body's main source of energy. In healthy people, the kidneys reabsorb glucose from the urine and return it to the bloodstream. High levels of glucose in the urine can be a sign of diabetes. Glucose in the urine, glucosuria, may indicate poorly controlled diabetes. Ketones. Ketones are produced when the body breaks down fats for energy, instead of glucose. High levels of ketones in the urine can be a sign of diabetic ketoacidosis, a serious complication of diabetes. Urine tests for ketones can help people with diabetes monitor their condition and prevent complications. Ketones in the urine, ketonuria, can be a sign of diabetic ketoacidosis, DKA, a serious complication of diabetes. In addition to these tests, other investigations may be conducted to evaluate the overall health of individuals with diabetes, including lipid profile, to assess cholesterol and triglyceride levels, kidney function tests, such as creatinine and urine albumin to creatinine ratio, liver function tests, and more. It's important to note that laboratory investigations should be interpreted in conjunction with the patient's clinical presentation and medical history. The specific tests ordered may vary depending on the individual circumstances and the healthcare provider's judgment. Thanks for watching.